Yep. Good morning, everyone. Jennifer Purcell, Senior Vice President and Director of Development with the Alliance of Arizona Nonprofits. We are here today to talk about the health benefits cost-saving programs that we have, and we've got a number of people here. I know that we'll have more that'll join us in the room. It looks like we've got about 15 or so here right now. Stephanie Waldrop with Employee Benefits International, or EBI. You'll see their logo at the top here. We've been working with Stephanie for many, many years. She actually helped us get the healthcare pool started for the Alliance and the nonprofit sector here in Arizona. And since then, we've actually added a few more programs, including one for employers with 5 or more employees and a telemedicine option, as well as some dental and vision options. So today we're going to be going over all of those. We've allotted an hour-and-a-half time to make sure that we have enough time to cover all of that, plus answer any questions that you may have. So with that, I'm going to let Stephanie take over from here.
Perfect. Thank you, Jennifer, and thanks to all of you who are dedicating your time this morning to learn more about how we can collectively really leverage the nonprofit community and the buying power of the nonprofit community to provide more stable and comprehensive programs for really smaller nonprofits. And when I say smaller, most of the programs we're going to talk about today best serve nonprofits with up to about 150 employees. There is potential benefit above that number, but that's kind of a breaking point where we see other alternatives come into play as well that we need to assess also. So that kind of gives you an idea. As Jen mentioned, we have been, EBI and myself personally have been working with the Alliance since actually 2014 to develop programs and help nonprofit employers really attract and retain employees. And so I'm gonna kick off our presentation today just with a highlight of the content we're going to cover. We're going to tell you a little bit about who is EBI in the marketplace and who are we as it relates to our values and core beliefs in serving our nonprofit clients. We'll talk about the scope of services to a very narrow degree, just to kind of give you a high level of, we partner to not only create benefit programs that are in line with your goals and objectives and meet the budgetary needs of the nonprofit, but also some of the other ways that we help our clients beyond just the program design and implementation. A little bit about our team that serves our nonprofit sector. We'll go into telemedicine and the minimum essential coverage plans as the first. Those are benefits that are available at 1, and then as Jen mentioned, the minimum essential coverage at 5 employees. We'll then dive into the nonprofit major medical pool, which is the more comprehensive solution, healthcare reform, ACA compliant, if you will, ACA standing for Affordable Care Act, programs that are available. And then we'll round the corner and talk about dental and vision programs that have been introduced through Delta Dental of Arizona and in conjunction with the Alliance of Arizona Nonprofits. So with that, I will dive in here. So again, partnership since 2014 started with a nonprofit healthcare pool. As Jen mentioned, this was the #1 requested benefit in member surveys and feedback to the Alliance in terms of how nonprofits really were looking for the Alliance to help them as an employer meet their goals and objectives. So we've then expanded that now into some additional benefits. So since 2014, we have been the endorsed broker partner for the Alliance of Arizona Nonprofits with a commitment to create best-in-class solutions and continue to renegotiate and look to improve those programs each year, and working with our partners to make sure that they continue to meet the needs of the nonprofits that we're serving through this process. So I I indicated I'd share just a little bit about who we are as EBI. We are privately owned and operated. We are situated in the Phoenix marketplace. We do have clients all over the country, candidly, with a big concentration here in Arizona and throughout Arizona, to all regions of Arizona, I would say, especially with our nonprofit programs. That said, we are part of Benefits Partners, which is a comprehensive collaboration of over 215 different offices that represents over 42,000 benefits professionals in the industry. We span 44 states and over 50,000 corporate clients. So we're constantly leveraging that buying power, as I talked about with the nonprofit community, along other lines as well, when we look to collaborate on adding value beyond the program design to our clients. And that looks like leveraging discount or brain trust, extended rate guarantees, those types of things in the programs that we serve based on those national breadth and memberships. So it's kind of the best of both worlds. You get the local privately held company that understands the local needs, as well as a sense of community, but also the national expertise and bench strength to pull from in terms of some of the resources that we have access to. So our approach in general is that we seek to do the right thing by the individual employee, and that's to provide solutions to their employers that deliver better benefits at a lower cost. So we do that through leveraging our knowledge and expertise of the industry. A lot of times it's revealing unnecessary cost or it says outdated here, I'm going to say somewhat predatory practices that might exist within the insurance industry to drive up profits. When we are leveraging larger populations, we're able to negotiate many of those terms out. And really at the core of who we are is we're willing to go to bat on behalf of our clients. Our allegiance and alignment is always with our clients first and serving their employee needs, which is not always the case in the industry that I've called home for a little over 20 years now, in terms of how decisions are made or aligned. So sharing that. And we truly believe that better benefits does translate to better employees, to longer tenured employees, to healthier employees, to happier employees, et cetera. So it's meeting employers where they are to develop the program that they can do now, as well as develop those long-term goals. And I can tell you, we have worked with smaller nonprofits where that's, a 2 or 3 year journey to get from where they are to where they really want to be from a benefits perspective, but they're able to bring their board along for the journey with data and information, and really, grow into the type of program that they aspire to have as an employer. So some of the most rewarding work we do. I won't go into the long definition of all of these, but we think it's important when you're partnering with a company to really know who they are, what their values are. We believe that at the end of the day, results for our clients is what matters most, and that's based on a lot of feedback also from our clients. At the core of who we are is people over profits, collaborating and working closely to ensure that we clearly understand the needs and budget of the employer, of their employees, in the process of program design. Honesty, we want to be really clear about what the pros and cons are of different types of programs that you might purchase, whether it's a budgetary concession for a richer benefit level or a savings for something that could have some adverse effects on the overall program. So we just always want to be really clear in our communication about what employers are making decisions based on and how the program will work for them. And then expertise, we're constantly learning, growing, and candidly, I say I wake up every morning looking at the different ways that the system can be broken to be fixed, if that makes sense. Looking constantly for ways to help evolve our healthcare system to be more aligned with the needs of the individual member, to be more budgetable and long-term sustainable for employers. And so we do that through a variety of ways, but it's at the core of who we are to be part of that conversation and to be constantly looking for what are the solutions that nobody's talking about? Who are the partners that are doing the best job with transparency in the profits and cost containment structure? So that's just at the core of who we are as well. This is a comprehensive list, since there will be a recording sent out on this, and also in the interest of getting to everybody's questions today, I won't go through all of this in depth. I will say that we are a comprehensive one-stop shop benefits consulting and brokerage firm. So there's really nothing in the scope of benefits that we can't help you with, or have a very aligned strategic partner that we have vetted and know does a very good job if it's outside of our scope, which sometimes happens as we delve into some HR related services. Some we do provide, and others would be a layer outside of us. So just to kind of share that. Our nonprofit practice really is comprised of a whole team. As we talk through some of the programs today, I think it's important to know that we do have, as I'll kind of hover over right here, Rick Roseanne on our team is our VP of Analytics and Underwriting. Rick comes from an extensive career on the carrier side in underwriting and actuarial services. He spent most of his career with Blue Cross Blue Shield of Washington. I like to say he now works on the right side of the fence, advocating all of that knowledge and leveraging all of those different levers to pull, if you will, and helping control cost and negotiate on behalf of our clients with the insurance carriers. So he's very involved in the process in our nonprofit practice. We also have Katie Brock, who's our account executive. Katie really specializes and focuses on working with our nonprofits that have between, the smallest size up to about 50 employees. And so her name may come into focus for you if you reach out for additional information and pursue learning more with us directly as a follow-up to this call. All of our clients are assigned an account management individual. In this case, Eloisa Garcia focuses on our nonprofit clients as a senior account coordinator. That's day-to-day questions, employee support, if there's a billing issue or a claims issue, those types of circumstances that come up when you have employee benefits. Employees come to you with a comprehensive question that's hard oftentimes for an employer to answer. And many times the employer is like, no, I don't want to know about this, just for HIPAA reasons. So we like to provide that layer of resource for employee advocacy, should questions or concerns come up, potentially even issues with claims as well in the benefit program. And lastly, I shouldn't say lastly, we have a compliance vertical. Susan Farber is a dedicated account coordinator. Compliance being a core focus of who we are as an organization. Beyond designing and implementing a benefits program, it's really important in our purview for employers to fully understand all of the different compliance regulations, state and federal, that are going to apply because they've decided to offer benefits. I can't even express how prevalent it is to come to work with smaller employers and find out that no one's ever talked to them about the compliance obligations. And most often there are many gaps in what's required versus what's actually being done. So that's an area we put a lot of emphasis on as an organization and provide services for, and all of our clients have a dedicated compliance coordinator to help them along that journey, to provide templates or solutions to help stay in compliance. And then lastly, in the HR and technology vertical, we provide a dedicated SPHR consultant to all of our clients. You have access on an unlimited basis, telephonically or via email, for HR related support and guidance along the way. So they're not hands-on directly interacting with your employees, but they are interacting with you or your management team to make sure that best practices to avoid risk and liability are maintained, and even down to updating policies and procedures where necessary. The HR technology component is really where we provide a platform for technology for our clients to allow employees to have a single source login site where they can review all their benefit information. They can make their elections. In many cases, that information can then feed over to some of the partners we're going to talk about today for additions to the plan or terms from the plan as they're approved at the administrator level. So it really cuts down on that administrative time associated with managing the plan. But what it also does is creates a much cleaner process and data in terms of eliminating those paper processes and those manual processes, not just for the employee, but also at the administrator level. So I've talked about the next couple of slides at a high level as we have gone over kind of the team and the verticals here. And this is just a little bit about our process. We start with a program analysis of where you are today, what benefits you're offering. In that program analysis, we're also reviewing how that compares to benchmark data. When we look at benchmark data, we use the largest national survey that's completed for employer benefits. And we're comparing what you're offering today, if that's a benefit program, to what the benchmark data is. And then we move into that strategic planning where we look at the best opportunities. We prioritize with you what's most in alignment with what you're looking to accomplish at the employer level, and then put together a plan of action from there, which takes us into step 3, which is going out to the marketplace. We do have strategic programs that are specific to nonprofits, and we're going to talk about those today. We also are a full service brokerage and consulting firm, so it doesn't mean that we eliminate the conversation about all of the other options available. Our commitment to the nonprofit community, and we are very aligned with the Alliance of Arizona Nonprofits and wanting what's absolutely best for you as an employer to meet the needs of your budget as well as the needs of your employees. So we will analyze all of those options as your broker partner and determine which options are going to be the best for you based on your goals and objectives. Then we move on to implementing the programs, educating employees, engaging them in the conversation to enrolling in their benefits. We implement any of the compliance obligations necessary based on the programs that have been selected. And then we go into a proactive service and management of any questions, concerns, or issues that may come up throughout the plan year as we roll then back every year into that program analysis phase again. All of the plans that we're going to talk about today do have a renewal cycle, which means we implement them, and generally on a schedule of 12 months, then we're going to be revisiting the carrier's response to the upcoming renewal cycle. And if you have benefits today, you're familiar with that process. So this is the technology platform that we utilize, Employee Navigator. There are other agencies that utilize Employee Navigator as a technology. I will share candidly. I think what sets us apart is our internal expertise. We have dedicated team members that build out this platform, that support this platform and help employers have data integrity within their platform with regards to their benefit program. We are completely setting up the platform based on the benefits that are chosen, and only looking for our employer partners to review that information and make sure it's aligned with the decisions that they've made, which any technology platform will have that type of partnership. So our engagement and the way that we help employers leverage this technology, I would say, is unparalleled in the marketplace. And so now we're going to get into the meat a little bit, and we're going to talk about the first partner that we have for the nonprofit benefits. And so here, I'm going to start sharing with you about EMI. So EMI it is a nonprofit organization. They were founded in June of 1935. They were originally formed as a teachers' welfare organization, which was Educators Mutual Insurance, which is what we get EMI from. They've now evolved into a mutually owned nonprofit company. At the core of who Educators Mutual Insurance was at their foundation was starting a nonprofit insurance plan with the goal and intention of being able to redirect the wasted cost in healthcare and excess profits back into the benefits programs for teachers. And so that is really how their whole passion and motivation to join the insurance industry started back in 1935. While they remain a nonprofit organization, they obviously are serving far more than teachers today. So they are based in Utah, but they operate in multiple states across the country today. There are no stockholders, as you know, for a nonprofit organizations. Excess earnings are redirected 100% of the time back into lower premiums, better benefits for the subscribers or employees in the program. So we'll talk a little bit more about how that works as we get into it. what EMI Health is offering to Alliance members is what we call a pooled self-funded medical program, where nonprofits are able to come together and leverage that buying power of the nonprofit community. We'll talk a little bit more about how that program works, and of course, pause for some questions at the end, which is a great time for me to say, as I get into some of the meat of these programs, as you have questions, feel free to post those questions. Jennifer's going to do me a great favor and review those, and anything that I haven't answered through the course of the content, when I pause, she'll go ahead and make sure that we get to those remaining questions. And we should have plenty of time scheduled today to do that. So don't be shy if there's something that you want to know a little bit more about. EMI does administer health plans for over 317,000 members today, and are managing over $435 million in premium revenue. The reason I feel like that's important to share, after I say they're a nonprofit and it's not all about the dollars, is because when it comes to our insurance, we want to know that we're working with both a financially stable organization that has an ability to pay our claims, but we also want to have a comfort level that the types of coverage and quality are going to be recognizable and comfortable for our employees. So I think as I continue to share about EMI, if you haven't heard about them in the past, you'll feel more and more comfortable with who they are. But I start with this number because I think it's important to know that they are not small, they are not new, but they are still not a household name because the way that they serve the communities that they're in, which is through these types of programs. They have been in the Arizona marketplace since 2014, exclusively with these types of programs. So just to kind of share, if you haven't seen their name before outside of the communications from the Alliance, that wouldn't be all that surprising to me, just knowing, how they grow and partner. So the first benefit that I want to talk about that we offer through EMI is a telemedicine benefit. The telemedicine benefit that's available is powered through partner Wellvia. And this benefit is available at one or more employees. So when we have attempted to find additional solutions throughout our partnership with the Alliance, we continue to look at what can we offer to those nonprofits as small as just one that want to provide some value in the way of their benefits offering to their employees, where they may not qualify for the group benefits that require 2 or more employees in a lot of cases. So so the telemedicine program is pretty easy to share, but I'll start by saying, if you're not familiar with telemedicine at this point, most people who weren't familiar got very familiar during our recent COVID-19 experience, where accessing a physician was not nearly as easy as it had been in the past, or in many cases comfortable. So the telemedicine allows really any member that has access to this benefit to speak with a doctor 24 hours a day, 7 days a week, and 365 days a year. So this allows a member to schedule a doctor consult, to review, whatever concerns or ailments they have going on for them or any of their household members, and to get guidance over the phone, online portal, or mobile app from the clinician. So that is at the essence of how the telemedicine benefit works. Anyone who's covered on the telemedicine benefit is able to access that conversation with a doctor and get access to a prescription if the physician deems necessary, with a $0 copay. So there's no cost associated with using the program as long as the member is covered on the benefit. It does require that the program is paid for through the organization. So that means one of two things. I will tell you, I think in every instance so far, I can't think of one that has been structured otherwise, but because the cost of this benefit has been negotiated so low for our nonprofit members and employers that are members of the Alliance, of only $5 per employee for the employee and their dependents to be covered and have a $0 copay. Most of our nonprofits that offer this benefits to their employers to their employees are doing so with no cost to the employee. So the employer is generally picking up that $5 expense and providing it as an added value benefit. It can be offered to part-time employees. We've had some situations where where nonprofits have asked to be able to extend the benefit to board members. So those are all conversations we can have based on your goals and objectives. Some of those things do require us to go and get exceptions from our partner EMI, but they are conversations that we can have. Without question, you could offer it to your part-time employees and to your full-time, otherwise deemed benefit eligible employees within your organization. So you can enter the telemedicine program with any effective date. So if you said, I never knew this existed and I want to do it right away, we could literally have a telemedicine program implemented as quickly as June 1st, if that was your goal and objective. So that it is a fairly easy implementation process that really, even from an employee perspective. I should share before I get too far past this that you can offer this as an employee cost share benefit. So the employees are paying a portion of the benefit or even all of the benefit, but it does have to be administered through payroll, meaning the contract exists with the organization and the organization is responsible for paying the invoice. So whether that means the organization charges the employees through a payroll deduction to recoup that cost, or otherwise, if there is a cost share, as long as that's understood, it could be offered where the employees are paying for the benefit itself. I will share with you that comparable programs that have a $0 copay are oftentimes $15 to $20 per month for this type of program. So the discounting that we've been able to accomplish here for our nonprofit community is pretty substantial. And when you hear me say, which you will, if you attend any of our live seminars or any of the other educational topics that I do, I truly say that every employer can offer something to their employees. And oftentimes I'm pointing to these types of programs, a telemedicine program, or perhaps an employee assistance program, where you can start somewhere to provide a tangible value to your employees and support them in their healthcare journey. All of the groups that come into the telemedicine program do renew in January each year. So each year we're annually addressing the program utilization and enrollment and data stats and working with EMI to determine if any price adjustments are necessary. So that's that annual renewal cycle that happens in January of every year. Minimum plan enrollment is, again, only one. It can be offered, as I said, voluntary or with a contribution, all or in part by the employee. And it can be offered in combination with some other programs that we're going to share. So this is just a little bit more about the mobile device. It's very user-friendly and does allow that opportunity to actually interact with the physician via video if that is the desire of the member at the time. We have really great feedback surrounding this program and the engagement level. Especially the hardest part is to get employees to use it the first time, but once they do, you generally have repeat customers who never want to go back to the old way of accessing healthcare for their more everyday needs of services. I will tell you before I move on here that the American Medical Association estimates that about 80% of everything that we're going to the primary care, specialist, urgent care, and in even some cases, the emergency room can be properly treated telephonically by a physician. There was a lot of scrutiny on telemedicine when it first came out. And so there was a lot of studies and in-depth analysis done. In some cases, there were court hearings about whether or not this should be allowed. And so there was a very high level of scrutiny that really allowed for some really rich and great data to come to the surface about what is really appropriate to be treated telephonically. And I think that as you engage in telemedicine, you'd be really surprised by the vast array of different services that can really be covered in that setting. They will not ever prescribe a controlled substance. Prescription medications that require lab work and monitoring of organ functionality and things of that nature throughout the course of treatment is always something they're going to redirect you to a physician relationship for because of that testing that's necessary. But in general, there is a very comprehensive scope of services that can be accessed in this setting with a $0 copay. They will prescribe, again, where they see fit to do so, to the pharmacy of your choice. They will call in a prescription. The prescription itself on the telemedicine benefit would not be a covered benefit, meaning that the employee then, or the member, would then be working with the pharmacy to determine what the different options are, whether that's through the pharmacy's own discount program for cash pay or through another insurance the member might have, as well as programs like GoodRx and things of that nature. But there wouldn't be an actual insurance benefit associated with the medication with this particular telemedicine benefit. So I am going to pause on the telemedicine and see if there are any questions on this particular benefit before we start talking about the next level up.
There aren't any questions in the chat. However, if someone has a question, feel free to unmute yourself as well and ask it. We are not bashful. We're open to anyone speaking on the call.
Yes.
I don't see anyone unmuting at this time, so let's go ahead and continue. If something pops up, feel free to add it to the chat, and we'll stop periodically and answer questions.
Great. And it's never too late. So if you think of a question you have about the telemedicine later, we can always cover that when we do our next pause. So the next program we're going to talk about is Minimum Essential Coverage Program that's offered. This is also offered in partnership with EMI Health. Minimum Essential Coverage is a term that was born out of healthcare reform, when healthcare reform was assessing what was required of large employers in the post-healthcare reform or Affordable Care Act era. They assessed two different levels of penalty. One was a penalty if the employer didn't offer minimum essential coverage to essentially all employees. And the next level of penalty was based on affordability. So out of that definition of minimum essential coverage came these types of programs that are not comprehensive major medical. So if there's one thing I need you to hear at this beginning point, it's these are not comprehensive major medical programs. They are, however, programs that can provide a level of benefits to employees that may not be being offered any benefit today or have only options that they deem unaffordable to them and therefore are foregoing having coverage at all. So there is, I believe, a very specific place for this type of program. It is, I'm going to go over the three different types of minimum essential coverage programs that are offered in this package. You can see here, minimum essential coverage itself is just the basics and really what's just required as defined in the Affordable Care Act. Then we go on to Mec Plus, which is adding some prescription drug and office visits face-to-face with physicians. And then lastly, the minimum essential coverage enhanced, which goes an even deeper level with the pharmacy and the outpatient services available. You can enter again with any effective date for these programs. There is no underwriting process regarding any health status or of the employee population that would be covered. And there actually isn't even a requirement for census to provide proposals. You're going to see as we get into the next slide, the premium is pre-established for each of these programs, and it just is reviewed annually based on the overall book of business. We do have to have a minimum of 5 or 25% of eligible employees enroll. It's the greater of here. So if we have 5 employees, all 5 of them have to enroll in the Mech plan, which generally means the employer has to be willing to cover 100% of at least the lowest cost plan. I will tell you that we have had employers that say we only have 4, but we'll pay 100% and everybody will come on. And we have had success in those cases, but they are exception cases. So if you don't qualify for that 5, but you believe that you're in a position to cover the cost of the program for everyone where it would minimize that adverse selection for the insurance carrier, then we can certainly have those conversations and advocate on your behalf to see if we could potentially still offer the program. These programs can also be offered with or without an employer contribution, but the contract again is with the organization and then would need to be administered through a payroll deduction depending on the employee cost share. There's several different ways to put that together, whether it's the employer contributes all or part to a base plan and then allows the employees to buy up at their own cost or structures of varying degrees in the middle. So we can certainly talk about that. It can be, again, offered to full-time or part-time employees, and any combination of the 3 plans can be offered as long as we're hitting those participation guidelines. So you can really allow employees to pick what's going to best serve them in the plan designs that are available. Sorry, give me one second. scroll to the next slide. Well, let me just say a couple more things on this before I scroll to the next slide. So the network of physicians that's utilized in these programs where there are face-to-face visits included, or even on the basic Mech program for wellness services, is the First Health benefit network. And so this is a national network of providers. If you happen to have employees that reside in Utah, they do use EMI's proprietary network in the state of Utah. So all of that's unique to the member when they log into their app and search for providers based on where they're located. But just wanted to share that as a starting point. There is a 3% rate cap after the 1-year premium guarantee that's part of these programs that renews every January. I will tell you that we haven't seen a price increase in these programs since we implemented them a couple of years ago. We've been able to consistently add membership to them and control the price of the offering so far. So we'd love to see that trend continue. It's nice when we don't have increases in cost year over year. There are, as we look at the Mech Enhanced programs, additional benefits that are part of that, which is the discount vision program with the VSP network. So we'll share a little bit more about that as well. A couple more things that I wanted to share is that telemedicine program that we reviewed first is embedded in all 3 of these plan designs. So what that means is that whether the employees are offered the basic plus or the enhanced program here, all of the employees would have that $0 copay access to the telemedicine benefit as part of the premiums that we're going to share on the next page. And lastly, I'll share that you can offer this alongside the comprehensive major medical program as long as we can hit the participation triggers in each program. So that's more for a one-on-one conversation based on your population and goals, but just to share that there are scenarios in which we can package both of these things together to create a bigger spread in the price options that employees have when you have a really income diverse population. Okay, so this is an overview of each of those 3 plans. Again, at a high level, deeper dive can be done through further conversation, but I'll share that for the minimum essential coverage, you'll first note that this program, the defined premiums are right down here. An employee only cost is that $55 a month for this particular plan. It is going to provide coverage by the plan at 100% for all of the preventative services that are required through healthcare reform. That these are preventative services that are subject to an age and a gender schedule. It does include things like your annual physical exam. It includes mammography, colonoscopy, prostate screenings for men, a whole array of required or recommended wellness services. For children under the age of 8, it does also include all of the required pediatric screenings and wellness visits with immunization. So that is the essence of the preventative services that you can see here. I guess I left off the vision and hearing exams, which are allowed under the preventative screening as well. So these are all covered at 100%. Again, you'd be accessing that network of First Health physicians out in the state of Arizona. And then here you can see that there is certain medications under this Mech Basic plan that are covered at 100%. These are prescriptions that are deemed to be preventative in nature, and they are defined. There's a comprehensive list of the types of medications that have to be covered at 100% through a minimum essential coverage plan. This includes birth control, high blood pressure medication, cholesterol medication, a lot of those everyday maintenance type medications that are preventative in nature to avoid a much larger chronic illness or episode in our lives. So that's an example here. Again, we do have the comprehensive list of what those types of medications are. And then on this particular plan, if you needed a medication that was not on that list, then you would be receiving a discounted pricing or the carrier's contracted pricing associated with that medication, depending on, generic, preferred, or non-preferred. So the insurance carrier would not be subsidizing a percentage of it or a portion of it, but they would pass on their contracted or negotiated rate to you. And you could always compare that with other programs like the pharmacy's discount program or the GoodRx. And I always think that the most savvy consumers in this way win when you have more than one data source for potential discounts. And oftentimes the carriers is the best, but there are instances where you might find another program out there that's accessible with a lower contracted discount at the time. So the last thing I'll say is this minimum essential coverage. Again, if you are covering your entire family, the premium down here is $129 on this plan to get access to those benefits. These are total monthly premiums that we're illustrating here. So this is the total amount that would be billed to the employer. Now, whether all of that or a portion of that is being passed on to your employees becomes a part of our big picture conversation. And depending on your size, I will share with you towards the smaller size of the nonprofit community where they may only have 5 or 6 employees. You will be very hard pressed to meet the requirements of 5 or more enrolled if there's not a pretty significant subsidy of most or all of this lowest cost coverage plan. So those are some of the strategic conversations that we have along the way. And again, with all plans, the copay for the telemedicine remains $0. So if they do need to consult with a doctor that's beyond preventative, then they always have that fallback of the telemedicine benefit with a $0 copay for those everyday needs before they have to consider going beyond that for their outpatient care. The Mec Plus is really building on. So everything I talked about in the minimum essential coverage or orange plan here applies to the Mec Plus plan with some additional benefits. So that includes a 50% coverage by the plan for any generic medications. So, you know, now we're going to see the plan starting to pay a portion of the cost for pharmacy beyond preventative medications. And we continue to have the discount associated with medications outside of that for brand. Here you'll also see the continued recap of the preventative. And then lastly, we've added physician office visits. These are face-to-face visits with a primary care type physician. And there's a maximum of 3 face-to-face visits with a physician a year outside of wellness. So these would be considered sick visits, or a visit in which you have symptoms that you're seeking care from the physician for beyond wellness screenings. This is a $10 copay to the member covered on this plan for up to 3 visits per year. You can see the difference in cost for the Mec Plus. The drivers of this are, of course, that generic medication benefit and then the face-to-face physician visits at the $10 copay. As we move up to the Mech Enhanced, this is the richest program offered in the minimum essential coverage suite. And I'll just continue to add on to everything that's covered in Mech Plus a few additional items that I'll point out. The generic medications are now covered 90% by the insurance plan, and the member would only pay 10% on this Mech Enhanced program. Now we have brand preferred medications being covered at a 50% payment by the insurance plan and a 50% payment by the member. So much more comprehensive pharmacy benefit included in this particular program. We have our same preventative services covered under the plan. Here you're going to see an enhancement to the outpatient type services under the plan that are actually now going to be coverable claim by the plan. So you still have the 3 office visits per year with a primary care physician under this Mech Enhanced plan, but they are now at a $20 copay. But we're adding office visits for secondary care or specialist level at a $50 copay. You can see again, the 3 limit per year applies. Convenience clinics like Minute Clinics are now included in the benefit level of this particular program as well. You'll see a benefit for major diagnostic testing, such as CAT scans, MRIs, up to 1 per year per member at $250. It's not uncommon for a MRI type testing to range anywhere from $4,000 to $16,000, depending on where you go for these services and what type of imaging is required. So this is a pretty strong enhancement to the benefit program to have a complex imaging covered at the $250 copay. You can see minor testing for diagnostic lab and x-rays also included, again, at the 3 per year. This does have to be at the doctor's office visit or at a freestanding outpatient lab or imaging center. So it is not going to cover these types of services performed in a hospital setting. The cost is exponentially more expensive in that setting. So this is not intended to subsidize that access point, if you will, of care. It would need to be on an outpatient setting, but that would be at a $50 copay. You can see there are some injections that may be done in the physician's office that are not deemed to be preventative covered. There is a benefit level for surgery that's done in the physician's office. There's not a lot of items that are deemed to be surgery in the physician's office. I will just tell you very candidly up front. But there are things like a mole removal that are oftentimes done, wart removals, for instance, ingrown toenails, procedures, things of this nature that are deemed to be surgical procedures that are done in a physician office setting. And so there is a benefit for that, as well as some anesthesiology benefits associated with those services. We've got urgent care at a $50 copay and some benefit for medical supplies and equipment specific to diabetics at a 30% cost share. And you can see medical supplies. There are also some medical supplies covered at 100%, depending on the diagnostic codes associated with those treatments. So again, more information can be shared on this in a deeper dive, but for the high level, that's where I'll leave it. And then in addition to the screenings for your vision and hearing, you can see here on the Mech Enhanced, there has been a discount dental program added. And what this is going to do is pass on a contracted savings that's been negotiated for members on this program with the dentist to provide a 15 to 75% savings with the dentist office over what their billed charges might be for a given dental procedure. So it still is a situation where the member is paying out of pocket for the services that they obtain, but they are getting a contracted discounted rate in doing so. And you can see, lastly here, the Mech Enhanced premiums are notated right here on the right. So I am going to pause again now that we've been through the Mech programs and see if we've had any additional inquiries come in, and we can keep strolling if not.
Yep, we have a couple of questions. One was, does there need to be 5 or more enrolled in any given plan? For example, can they have 2 enrolled in the Mec Plus and 2 in the Mech?
So there is a minimum of 5 enrolled across all 3 plans. So they could have 2 in one plan, 3 in another. They could have 2 in one plan, 2 in another, and 1 in a third, you know. So, and again, you don't have to offer all 3. So it just really depends on budget and goals and objective, whether that makes the most sense or not. I will candidly tell you that I have some employers who have been in a planning stage and they are at the Mech Enhanced level, and that's what they pay for, and they provide it to all of their employees. And they've moved on to the point where they're offering maybe that more comprehensive program as a buy-up strategy right now, with the intent to continue to grow into a more market competitive benefit program for their employees. I have others who start at the minimum essential coverage and say, everybody should have something. We're going to pay for this benefit and allow employees to buy up for now because that's where our budget allows. So there's really a lot of different ways to structure it, but the simple answer to that is we do need a minimum of 5 enrolled across the offering.
Okay. Question about whether these plans recognize same-sex marriages.
Yes, that is actually now a federal mandate. So as the federal government determined that that same-sex relationships could marry, there is now a legal dependency relationship created, and so that is no longer the option of a carrier to allow or disallow. The domestic partner level coverage is still something that is at the employer level decision.
Okay. Another question we have is, how can someone determine the physician network and that they have covered physicians in rural Arizona communities?
Yeah, so we help them with that through the continuance of the conversation. We have links to find physicians in the network to run reports on contracted doctors in a given region or location. So whether that's a much more comprehensive listing and we're working with our carrier partner to provide that, or whether it's a more targeted search, we have tools and resources available.
Okay. And then I think this is pretty similar to the one before. They just asked, can employees choose different benefit plans, or would all employees have the same plan? And I know you answered that earlier, that
Yep.
they can choose depending on what the employer is offering.
Correct.
All right, that covers the questions up to this point.
Perfect. So next, we're going to dive into the major medical program. Again, I referenced this earlier as the comprehensive solution for healthcare. These are all programs that meet the minimum value requirement under the Affordable Care Act. They all provide an unlimited benefit. And maybe the most important distinction here is that they're all providing covered services for inpatient care, that most costly care that we might access as an individual in the healthcare system if we had a catastrophic medical event. Arguably, the reason that insurance at its core was actually created, right, was to help us avoid financial catastrophe if we did have a major healthcare event that was not something we could sustain financially. So we're going to dive into these programs. The nonprofit pool in Arizona was launched in 2014, as we shared earlier, but EMI as a carrier has been operating pools since the year 2000 in Utah, and it is their primary market approach today in the states that they operate, is to create pools that really allow a leveraging of industry buying power and employers within a common industry to come together and collaborate on solutions. So there are some stats that I want to share with you. I'll just point out this chart at the bottom shows, really where the pool has grown, as well as the rate increases, probably the most important thing that I'll share with you today. So one of the goals and objectives of EMI in the marketplace really is to provide a much higher level of stability in the overall year-over-year increases. So to get away from this, what I will call insurance carrier trend of high growth years where they go into rate discounting to take on additional membership, followed by high profitability years where they jack up those rates that they came in hot on. Sorry about that. In order to then, recoup some of that profitability. And so we see those cycles, and we live those cycles with some of our clients, right? Where one year we're getting a really great rate from a carrier, and then maybe the next year we see them come back and it's, worse than had we stayed put where we were. So EMI does a really great job of creating stability and not having those types of cycles, if you will, in the way that they approach their client relationships. And because of that, we see a really high level of persistency in the nonprofit pool. So we have 28. I know that the latest data in the grid has a slightly different information for 2021, but we do have 28 nonprofits participating in the pool today. Our 2021 pool renewal increase was 7.82%. If you look at our average increase over a 5-year period of time now, we're at an 8.3%. It says 5. I need to update that. I apologize. We're going back to really 2014 or 2015 was the first renewal year here. So we're at 6 years now, but that average increase at 8.39% over the course of a 6-year period of time. So if we look at just what healthcare trend numbers have looked like in Arizona over the course of that same period of time, I can assure you that it's been anywhere from 10 to 14% with the average carrier. And that's just what they consider year over year inflation in healthcare to pay the same claims that they paid last year. So averaging a increase at 8.39% that is considerably lower than what most insurance carriers in Arizona are considering their healthcare trend is a very favorable position. And again, much more budgetable position for our nonprofit employers to be in. With those variances in budget that occur a little bit more rapidly in the nonprofit sector. And then lastly, in the way that this program is designed is that if the nonprofits that are participating in the program are all paying into the benefit. We're going to dive a little bit deeper into that. But if there are surplus funds for claims, meaning that the premium was set in a way that there are funds left over after the claim obligations have been paid out by the pool, then the nonprofits who participated in that plan year actually receive a surplus refund proportionate to what they paid in. So it doesn't matter whether the particular nonprofit had a good year or a bad year from a healthcare perspective. The nature of the small employer market is you're going to have good years and you're going to have bad years. And so the idea here is to stabilize and have a more budget-friendly approach. But whether you've had a good year or a bad year, if you participated in the pool that year and there are surplus funds available, you would receive a surplus refund proportionate to what percentage you had paid into the claims fund with your group's premium. So you can see that twice now in the in our pool history in Arizona for nonprofits, we have had surplus refunds issued, and it's never the intent of EMI to collect more premium than is necessary for the benefit program. I can say that since the program has launched, we have had consistency in benefits. You'll see in a lot of cases, the out-of-pocket maximums available are still much lower, and a richness level to the benefits that are hard to find in today's environment. Their goal is to, again, stabilize benefits and costs. But if there is a surplus created, then that is going to flow directly back to the nonprofits who participated that year. They are done on a delay because claims come in on a lag to the insurance carriers, and then there's a provider timely filing provision that in most cases allows providers to file claims up to a year after services are rendered. So the 2019 surplus was actually just issued at the early part of this year. So the 2020 and 2021 don't show a surplus, but they also haven't been calculated yet. So there's still possibility that we would see surplus for those years. So if you are part of the nonprofit pool for the major medical program, each group within the pool does have a representative that would be able to vote if there were a request for a change in benefit or potentially a change in network alignment, things of that nature. If there is something that's going to be taken away or changed to, maybe a higher copay level to save in premium, that is the type of event that would come to a vote within the nonprofit pools participating. So if you have someone that says, it's great that we haven't changed benefits, but our copay for emergency room is just really too low when we compare it to all the other plans out there now, and we'd rather save additional on premium this year. What could we do with the pool renewal increase if we made a change to how the emergency room benefits covered? The underwriters and actuaries would price that, and then they would bring it back to the nonprofit community that's currently participating, and each nonprofit gets a vote as to whether or not they'd like to see that change take place. It is one vote per nonprofit that participates. So the larger nonprofits in the pool can't over contribute to that discussion, if you will. It's one voice per organization that participates. Although I can tell you that the very few changes that have taken place have been unanimous. So we really don't have that lack of alignment within the community. The pool does come together on a quarterly basis. We have been doing these via Zoom. When we get back into the swing of things, I expect to see some in-person meetings come back. Those are held here in Phoenix. And while I can tell you we have had nonprofits travel to those meetings, they're always available via Zoom. The meetings and notes do go out as a follow-up to the quarterly meetings. They're really intended to keep the nonprofits apprised of what's happening within the pool. We talk about growth in the pool. We talk about any trends that are that we're seeing develop within the pool. We talk about opportunities for increased employee education and engagement surrounding certain things. They will share new employee tools or flyers, whether it's about the cold and flu season in telemedicine, or whether it's about a new discount program that's been rolled out where employees have access to discounts for just about any anything from gyms to travel related expenses through their membership with the nonprofit pool. Those are all things that those types of new employee facing communication and engagement materials are unveiled, if you will, in those meetings, and then sent out as a follow-up. So you don't have to attend, but we do have a pretty high participation rate among the nonprofits that participate in the pool today. The comment that I get very commonly is they feel like they're more aware of what's happening with their employee benefit program, and how things are determined than they have ever been before. And it's no longer just waiting every year for a carrier to issue a renewal and tell you what their new plan designs are and what it's going to cost you, and feeling, really kind of powerless to have a voice in the conversation or understand what's driving that change. So there are two different renewal dates within the pool. You can come into the pool with any effective date, but you will either renew in January of every year or you will renew in July of every year. So those are the two different renewal dates of the pool. So depending on when your entry point is, you'll either have a longer contract period or a shorter contract period associated with your nonprofit pool renewal. There are there are a variety of plan options, but I want to start with some just general information. This particular program does require 10 benefit eligible or 7 enrolled employees as the minimum requirement. I say that a little bit tongue in cheek because we have had nonprofits that we pursued exceptions for that have been granted access into the pool. And we can share more about that if that's something you're interested in pursuing and that's you. I will tell you the smallest we've had success getting into the pool today was 5 enrolled. And again, if you have 5 benefit eligible employees, we would need to be able to present that all 5 were enrolling in order to even have that conversation with our carrier partner EMI. There are 2 different provider networks to choose from on this particular program. Again, this is the more comprehensive program that's going to include all the covered services for inpatient care. Blue Cross Blue Shield is the primary network today that's utilized for the nonprofit pool. I can easily say without any hesitation that is the most comprehensive network in the state of Arizona. If we're looking at statewide access and rural nonprofits, employees access to providers and hospital systems. As we get into the Maricopa County area and employers that are more concentrated even in the metropolitan areas, I will tell you there's not a huge difference between the breadth of Cigna and the Blue Cross Blue Shield network, but we still do generally see a preference for the Blue Cross Blue Shield network when exploring these options for employees. The Cigna network would really be potentially a stronger consideration if you have out-of-state employees in your program and depending on the number of out-of-state employees. If you chose Blue Cross in the state of Arizona, because it is an Arizona state specific network and program, you would have First Health Network as a wrap network for employees that are out of state. So you still could have that combination. However, if you wanted the same network across the board for everybody, that's where we would look at the Cigna solution for your population. There's over 16 different PPO and HSA plan designs to choose from. So we really can look at what your benefits culture is today and look to what is most comparable under the nonprofit pool. Oftentimes we're showing, even for most comparable, significant benefit enhancements over what an employer is offering today. If you're not offering anything today, then we can start with where the budget alignment is or benchmarking data depending on those goals and objectives. The calendar year deductible options for these 16 plans range from $1,000 all the way up to $7,000. I will tell you that we did initially have a $500 deductible when the nonprofit pool was launched, but we went a couple of years without anybody actually electing that rich of a benefit program, and most of the other carriers in the marketplace had eliminated the $500 deductible. So it was determined to remove it from the portfolio because there just wasn't a demand for it. Even the nonprofits that were coming into the pool were not buying that rich of a deductible level. But it is something that always remains open for conversation with our EMI partner, which is something that we love, is that we do have a voice at the table when it comes to plan designs and what's really needed to remain competitive for our employers. Employers can offer up to 3 plans to provide employees with choice. There are some requirements regarding the difference in premium between the richest plan and the lowest cost plan offered that we have to evaluate. And that's just to make sure that we don't end up with a high level of adverse selection, meaning that only the employees that really need to access healthcare are the ones that are purchasing the plan because of the extensive cost associated with the benefits. So that conversation comes down to what the benefit mix will look like, as well as what the differences in premiums for employees between the different plan levels will look like, and determining whether certain plans can be offered together. It's not uncommon for me to get asked if we can offer the lowest cost plan with a $7,000 deductible, that maybe the employer wants to pay a much higher percentage or all of, and then the richest plan as well, because they want to give that richest level of benefit for employees that may have more disposable income, potentially even at the executive level, to buy up for. And that is a situation that does create a lot of adverse selection. And so, unless those programs are in place today and we can show a more even enrollment between the plans, that is not something that the carrier partner would generally entertain. So there are some limitations to that. I shared already about the premium refund. The other thing I will share here about the way the pool is structured is that EMI does include COBRA administration in the nonprofit pool for the medical plans. So it's most often when COBRA is elected, it is elected for a medical, although it's also must be offered for dental and vision if you do provide those benefits. The EMI will only administer the coverages that they are actually the insurance partner on, which in this case would be the medical. But it is a nice value add, especially for smaller employers. They will do that for the Arizona state-specific COBRA requirement if you have 2 or more employees. And you offer a benefit plan in most cases, unless you have an exemption for being a federal entity or in some cases a church. There are a couple of very small minor nuances in which you could potentially not be subject to the mandate. Most employers are required to offer COBRA, and our smaller employers find that to be, they wear a lot of hats. It's difficult to know all the different steps that have to take place under the mandate and communication, because there are a lot of them and they're on very specific timelines. And lastly, I'll just say, as it relates to COBRA, there's a very high risk associated with an employer not administering it correctly, not providing notice timely. An employer could actually be in a position to be liable for a former employee's medical claims if an event were to occur and the employee pursued action. And so in our opinion, it is always better to have the COBRA administered by a third party if possible. And in this case with EMI, it's nice to know that they will just take care of that, because the risk associated with medical COBRA administration is much higher than that, of course, of dental and vision, just by nature of the differences in claims that we see for those different benefit levels. So in terms of obtaining a quote, we need a few things. We need an employee census, which we have a very specific template for. The various carriers, including EMI, have very specific formats in which they have to receive that information. And so we do have to work with a census template to ensure that we receive all the information necessary to do diligence in the marketplace. If you're offering current plans, we require information on the current plan details. The insurance carriers, including EMI, require information regarding the current benefits that you're offering, the rates associated with the benefits. And if you're up for renewal, they also look to know what your renewal rate offering is from your current carrier. And I do get some feedback from time to time on this with regards to, well, why would we have to share our current cost information in order to obtain quotes? In the world of healthcare, especially with various different programs out there that do actually underwrite for risk and provide renewal action based on the risk or claims of the population, the renewal is actually an indicator to the underwriter in terms of the overall health status of the group or potentially an emerging claim within the group. So they do look at that as part of a part of their underwriting process. And many of the carriers in the marketplace, including EMI, will not issue a firm quote that you could make decisions on without having that information provided to them. So we can talk more about that one-on-one if that's a barrier for your organization, but I do want to be very upfront in saying those are requirements. There's also health information assessed. So the goal of the pool is to rate every employer coming into the pool appropriately for the long-term stability of the pool. Again, I get questions all the time. Well, why doesn't everybody just pay the same? The challenge is that if everybody paid the same, which has happened historically in healthcare, I mentioned I've been in this industry for over 20 years, and I used to work on the insurance carrier side with a lot of PEOs who used to do that very thing. And what inevitably happens if you try to price everybody with varying risk structures the same is that you create a plan where your healthier risk that can do better outside of the program continue to leave the program, and you get more and more higher risk over time that erodes the stability and even long-term viability of the program itself. So, underwriting for risk is the only way to have a long-term sustainable program in this type of an environment. If you have 26 or more employees, that looks like an employer-level health questionnaire. Again, we can share copies of that. That would also be required if you have more than 26 employees, but you've never offered a benefit plan before, so there's no current or renewal rates. That level of questionnaire is really meant to capture what an employer might know due to the normal course of business. It's not to have employers go and survey their employees about their health status. That would be very taboo under HIPAA. But employers are oftentimes privy to employees' medical situations due to short-term disability, FMLA, general approved medical leave of absence, or just even things that employees have disclosed to them because they require special accommodation in their work environment. So it's not meant to be any further reaching than that, but it is required at the employer level that what the employer is aware of is disclosed in that process. If you have less than 26 enrolled, then there is an individual health statement that's required. And how this is accomplished is through a HIPAA secure technology platform that we actually deploy on behalf of our clients. As we take that census data, we upload it. Employees are actually sent a link, and they use their own personal identifiable information to log into the FormFire portal. Once they receive that link, they'll establish their username and password, and they complete their personal health history statement for them or any dependents that might be enrolling in the plan. Whoever at the group is facilitating making sure we get this back for everybody can only see which employees have not yet started, are in progress, or have completed the medical questionnaire. And that's for the process of keeping the program moving, because we're not able to actually go and pursue the underwritten proposals and begin that negotiation process on behalf of our clients until we have those, all of the employees that are deemed to be enrolling on the census completed in the FormFire process as well. That is not unique to EMI. Hopefully most of you know, as small employers down to as small as 2 employees today, there are more underwritten options in the marketplace today than there are what we consider fully insured or community rated options. Community rated options in the small employer space is where they're just looking for a census, and your demographics are going to determine what the rate is with the health insurance carrier. The carriers publish those rates quarterly and adjust them quarterly as well with the Department of Insurance. So we, as a comprehensive brokerage partner for our clients, will look at both the community rated options as well as the underwritten options. But I will share with you in complete candor that about 85% of the time we see the underwritten options being a much better value for our clients. So that process generally pays in dividends to be able to negotiate with the carriers and provide underwritten solutions in the marketplace. And again, there are far more underwritten options today than there are just the limited number of carriers that are publishing their rates quarterly. And the reason I would say that we're seeing such a high propensity of the underwritten solutions being better from a budget and value perspective to employers is really because those community rates, because they can't be underwritten based on the risk that the group could be bringing to the insurance carrier, and they have to be filed quarterly and can only be adjusted based on the total book of business, meaning groups with a similar average age, geographical region. those types of programs really have become a risk pool type environment for the insurance carrier partners. So they have really built in additional I'm going to say padding in the rates because they're not able to underwrite for the risk and they have to wait a full quarter to make any adjustments to it. So that is why we see that scenario. It's great to have as a fallback option if it is going to be a better scenario for your population. It's just not very common that we see that to be the case today. And then the last thing I'll say here is that after we receive all of the information that's necessary to begin the quoting process, it takes an average of 3 weeks. So it's 2 weeks to get all of the underwritten quotes back, and then another week to really negotiate the best options and any additional rate relief available with the insurance carrier partners to provide the best possible solution. So that's a typical timeline. That can be compressed. We have groups call us all the time and say, we're coming up on our renewal and we just got the presentation from our broker and found out our costs are going way up and our benefits are getting cut, all the things you talked about in that presentation. Is there anything you can do for us? We can act in haste. Depending on the circumstances and the timeline, we have to, discuss one-on-one what that looks like and what we can do in the amount of time that's being provided. But don't feel like if you don't have 3 weeks, then there's no help for you, because certainly there are circumstances where we can still help pretty significantly without having the full timeline. We like to avoid those though, if it ever possible. So if you have the ability to have proper planning, that would certainly be the preference. So I'm going to pause again and see if there are any questions on the programs that were just presented for the comprehensive medical benefit.
There are not any questions on that at this time, so we can move on to the dental and vision component.
Perfect. I'll address one thing that came up on the minimum essential coverage plans. I mentioned that you can have up to 3 different plans. If you're offering more than 3 plans today, that is an exception we can pursue. And we can talk more about what the different factors are that the carrier considers in terms of approving or not approving that. And then also there is no participation requirement for each plan, just for the program overall. And so the participation requirement for the major medical coverage, the general requirement is 75% of your benefit eligible population to be enrolling in the program. And then again, that's at any level. So your lowest cost plan to your highest cost plan. If employees are waiving because they have other creditable coverage, whether that's through the individual exchange or whether that's through access, could be Medicare, could be TRICARE, could be a spouse's plan. There's lots of ways in which employees might have other qualified comprehensive coverage. In that case, EMI will go down to as low as 60% of your eligible population participating. So 2 last qualifiers there. And now we will quickly go over the dental and vision, and looks like we'll be coming right up on our scheduled time as we land these last couple of benefits. So we did partner to expand the benefits available to the nonprofit community, and again, picked a nonprofit insurance carrier in Delta Dental to be the solution for the nonprofit community. Very aligned with who Delta Dental is as a carrier and as an organization, to partner with EVI and the Alliance exclusively to provide these benefits for nonprofit employers. There are several provisions throughout these programs that are generally limited to the largest employers that Delta Dental might insure, that have been included in these programs, down to as few as 2 employees in the nonprofit sector. And that really is a testament to their alignment with supporting the nonprofit community, as well as to the buying power, again, as I say, of the nonprofit community, because there are a vast number of nonprofit organizations throughout the state, and coming together in these types of programs benefits everybody really in the long run. So the dental and vision are available at 2 or more employees. If you have only 2 employees, then both employees do have to enroll in the program. So I will answer that right out of the gate. They can be made available on an employer paying a percentage contributory or a voluntary basis. So that's really, this is an example of a benefit, as was the Mech and telemedicine, of programs that employers can offer with really out having any benefit budget to speak of, that are high value programs that can be offered with little to no cost as the employer. So again, I'll reiterate, I truly believe to my core that every employer can be doing something to provide value to their employees in the benefit program, regardless of their budget. As it relates to Delta Dental, I will tell you, well, dental and vision in general, employees cannot purchase a comparable program to group dental or vision coverage on an individual basis. There are plenty of programs out there for individual coverage. They are not comparable to the levels of coverage or the access to coverage levels with waiting periods and things of that nature is being very prevalent in individual plan designs. So this is truly something that your employees don't have access to a comparable level of care unless it's offered through your organization or they have a spouse that has one offered through their employment. Dental, you can have a single plan option. You can have a dual choice option with high-low plans, and we'll talk about what those scenarios look like. And then the dental and vision programs do have to be offered together. These, again, I mentioned there have been a lot of concessions that are made here to offer the richest level of benefits that Delta has available in their suite of products down to the smallest level of groups. There are no waiting periods for any care under covered service under the program for employees that come into the program. So in conjunction with that, they have put a requirement that the dental and vision programs must be offered to the employee population together. So employees can still choose independently. So as long as we do meet the minimum participation requirements, an employee can choose dental and not vision and vice versa in the program. So they don't have to enroll in both to enroll in one or the other. Plans are available for any effective date, but they do consistently renew on January 1 each year as a group. So as a group renewal, we have had great success since we launched this program. We had no rate increase, and then in the first year, and then in the second year, we had a rate decrease, which was very exciting. And we're coming up on our third renewal cycle, so our fourth year of offering these programs. And we're excited to have those conversations with Delta again, because as we continue to grow, we have more leverage in those conversations to continue to serve the nonprofit community in the best way possible. We are working to potentially have long-term more options as it relates to the renewals. For instance, if you're a 7/1 renewal in the nonprofit medical pool, we still can offer you a 7/1 renewal in the Delta Dental programs. It is only a January 1 renewal, so we would have a different renewal cycle if those were your two solutions. Delta understands the pain point associated with that, and we are working through it. They are doing a pretty robust system upgrade, and they believe that their new system will be able to accommodate that differently. But I would say we're at least a year out on being able to pursue that conversation again as they roll that system out over cycles and waves of their client population. So these are the actual plan designs, and you'll see at the bottom here the published rates associated with this. As I mentioned, beyond the benefits that you're going to see here today that I'll point out to you, down to the smallest employer of only 2 lives, being fairly rich in comparison to many small group programs that are available. I do want to share that there are also several contractual provisions, meaning frequencies of different types of services that can be accessed under the plans, coverage for dental implants, things like that that you're not going to see on this high level grid that are major differences from one dental plan to the next dental plan. So the intent here is to provide a really comprehensive and valuable dental program down to the smallest employers at the most affordable premium. It is not to get to the lowest possible price and erode the contract and benefits that are offered to the employees. So I say that because we can compare these programs to other programs or other carriers or even Delta Dental small group contracts that they may offer in the marketplace and point to a lower premium But 100% of the time that we've been put in that position for our existing clients, or even for prospective clients that we're talking with, there are some pretty significant differences between the program that really do make the nonprofit pool a better value. And we welcome that conversation if you're comparing your Delta plan or your current dental benefit plans to these rates, because this high level overview when it comes to dental is far from the whole story in terms of how the plan will actually work and serve your member population as their dental needs arise. So let's just kind of dig into this here. The benchmark plan in the marketplace today is still, I'm going to say the benchmark points to $1,300 in terms of the annual maximum benefit that an employee would receive. There's not a $1,300 annual maximum plan in the marketplace. What that really means is that employers, a lot of employers still have a $1,000 annual max, and many have now moved on to a $1,500 annual max. So it's trending towards $1,500, but we do still see a significant number of employers that have a 1,000 annual max, as well as those that have moved up to the 1,500 max. For many dental insurance carriers, 2,000 is the richest annual maximum that they offer. There are some that are above and beyond that now, although I could have a very candid conversation with you about the real value of those programs based on the way dental insurance works, but it does look nice on paper, I will say. Preventative services on all the plans are covered at 100%. That's your cleanings and your imaging or screenings associated with your preventative services. Basic services, which are going to be more simple services like a filling or extraction under the plan, is covered at 80%. You can see your major services covered at 50%. These are much more comprehensive services under your plan. Oftentimes we're looking at wisdom teeth extraction or root canals, things of that nature under the dental program. And again, a much more comprehensive definition of each of these categories, if this is unfamiliar to you, is certainly available if you want to dive deeper. What's going to vary for these plans as we look to the plans with the comprehensive or PPO network, I want to start by saying that all of the programs that are labeled PPO here at the top, these are offering you access to not just the Delta PPO, but also the premier dentist in the state of Arizona. So Delta has a whole network of dentists that by definition do not contract with any other insurance carrier. Delta puts them in what they consider their premier network, and they pay them a little more for their contracted rates for the exclusivity that they would only be contracted with Delta for Delta members. These are oftentimes the most sought out dentists in our more metropolitan areas that otherwise defer to cash pay or out of network billing and balance billing the member if they're not a Delta member. So again, largest statewide network of dentists available, as well as, of course, the national network associated with Delta's association as well. The big difference you're going to see across the bottom here is the annual max. And then as we get into the orthodontia benefit, how that works and how much is available separately. So this first option A, you can see is if you just offered a single plan that's, again, slightly richer than the benchmark to your employees. There's one set of rates. These are the total monthly premium that would be billed. Option B is you offer a high-low solution, which oftentimes will involve the employer picking up a percentage or the majority of the lower cost plan and then allowing the employees to buy up. It can be offered, again, purely voluntary. So it does not require an employer contribution. In this case, you can see the low plan is that $1,000 plan that's still pretty prevalent today. But it does include a child orthodontia benefit of $1,000 as well. And the buy-up plan is going to have a $2,000 annual max with an adult and child orthodontia benefit of $1,500. Lastly, option C allows for you to offer this, again, slightly richer than the benchmark PPO plan at the same rate as we previously illustrated standalone, but alongside now a dental HMO plan, which does actually reach into some of the more rural areas of Arizona. So we could certainly evaluate that for your population if that applies to your organization. But you can see that is the lowest price point in the program for the dental HMO. as with all dental HMOs, this program has no deductible, and it also has no maximum amount of services that could be covered under the plan in a given calendar year. It does restrict the access to only specific dentists. And then there is a set copay amount for each type of service that you would access under the plan. So it is a great program for employees that either have no dentist today and are open to going to any contracted DMO dentist, or employees that find that their dentist is contracted with the DMO, because it's going to provide some of that comfort of knowing that there's no maximum amount of benefits that they could occur, and in some cases their copays or cost share associated with some of those services will be lower as well than if they had paid a deductible and cost share under a PPO plan. But there is no out-of-network benefit on the DMO plan. So you're either going to a dental HMO provider, or you are completely paying out of pocket for the services with a non-contracted provider. So minimum of 2 or 25% eligible is the enrollment requirement with Delta Dental, and that's the dental program. I'm going to cover the vision really quickly here, and then we'll wrap with any final questions. I know we're just a minute over, so I'll be brief here. This is the Platinum program that Delta Dental offers. Again, the richest benefit available in their entire suite of vision programs. It does align with the IMED national network, so one of the largest national network of vision providers available. Again, the same requirements in terms of participation apply. In this particular plan, a few things I'll point out is the $10 copays for both your exams as well as for your lenses. In most cases is among the richest benefits you'll find out there. Most have gone up to $15 or in some cases even $25 now in the small group marketplace. So there is also a $150 allowance associated annually with frames under this program at a $0 copay, and then of course a discount off any remaining amount. The average cost of frames today at a Target or Walmart type retailer is $150. So this provides a really comprehensive benefit that will give employees options at no cost to them for their frame needs. The same benefit of up to $150 does apply to contact lenses, as you can see down below, contact lenses. And then another thing that I want to point out here is there is a discount. Oh, sorry about that. There is a discount associated with the LASIK eye surgery benefits. It's not something that's covered by the plan, but you can get discounted pricing for that. And then lastly, something that makes this plan quite a bit more comprehensive than most of the small employer plans that we look at is the frequency that employees can access their services. On this program, employees can access an exam every 12 months, contact lenses or new lenses for their frames every 12 months, new frames every 12 months, and then additional screenings for diabetic care services related to our eye health is covered under the program as well. So most oftentimes we will see a frequency of 24 months, particularly on frames, and sometimes across all three different types of services that a member would access. So that is one of the areas where we will see carriers load anywhere from 10 to 30% just to make a change in that frequency, because it does impact how much the plan, of course, is going to pay out annually. The monthly rates are listed here. Again, these are total monthly premiums. So if you're paid weekly or bi-weekly, you can see. And then if these are structured in a way that they come out of the employee's paycheck on a pre-tax basis, which is definitely a possibility, you can just really see that these types of benefits can be offered for very nominal cost to your employee and deliver a really high value. So I am going to do one final pause and ask for any remaining questions. And then, of course, should you want to schedule time to have a conversation following this meeting more about where your organization is and what our recommended approach would be in the marketplace, we are happy to do that. I know that our information is all on the Alliance of Arizona Nonprofits website. I've listed it here as well. And how that generally looks is once you reach out, we'll just work to get a time scheduled, and our team will come together and help you put together a strategy and determine whether you want to move forward with assessing these options.
Great, thank you, Stephanie. We don't have any other questions right now unless someone wants to speak up. Katie, are you wanting to ask a question? I just saw that you were unmuted. All right, we're gonna let everyone get off to their days. Stephanie, thank you so much. I did include the link to our webpage as well as the survey for today's webinar in there, and we'll see everyone in the fall. We'll be doing another one of these to share more information. Thanks.
Thanks, everyone.
Stephanie, let's see.
Yeah.